state of California. So Charlotte has really devoted her career to building organizations and movements to create healthy communities for people of all ages and backgrounds. She's worked in the fields of affordable housing, public health, and racial justice. She welcomes the opportunity to help frame aging and advocate for policy changes around this very important life stage. She is excited that villages are included in the master plan for aging, which is part of what she'll discuss with us today. She has a bachelor's degree from Duke University and MSW from Boston University. She is part of the sandwich generation. She has a Gen Z and a millennial daughter, Gen Z and millennial daughters, and she is the parent of World War II generation folks. So with that, Charlotte, thank you so much for agreeing to do this presentation with us, and I hand it over to you.
Great, thank you. Thank you, Carol. Hi, everybody. And I am going to start some slides, and you'll see that Carol is here. Let's see, I think everybody should be muted. That would be good. And Harriet, you can do that.
Okay. Whoops, but you're muted now. Can you unmute yourself?
I did. There we go. Okay. All right. So, what I want to do is talk a little bit about the context, which I think you're familiar with, so we won't spend a lot of time on it. Just the context in which the village movement is operating. Then I want to talk a little bit about this group of people called the missing middle. Then I want to talk about the village model and Village Movement California, and then give you a couple things to think about in terms of your own involvement, if that's something that you are interested in. And I'm trying to decide how to do this. There we go. Now, do you see my slide? Do you see my slide? You don't, okay. Because what I'm finding is that I really want to be able to see your faces, and I want to show the slides. And so I think what I'm going to do is show the slides, and if you have a burning question while I'm talking, just unmute and ask the question, because I would rather have us talking than me do this whole presentation, and it doesn't need to be that formal. Okay. Oh, yeah, I hadn't done it. I thought you saw it. We're always learning how to do this, even though I do it all the time. Okay. So that's what I'm going to do. Context, population, the village model, Village Movement California, and then call to action. So last week, some of you heard that Village Movement California had its annual conference. We did it on Zoom. And we had quite a few people, which is fantastic. I know everybody's really tired of Zoom, but here we are. We need to stay healthy. And we had Susan Damaris make a presentation. And Susan Damaris, you may know, is the director of the California Department of Aging. And Susan came into that position last fall after having worked as the legislative director of the Alzheimer's Association in California. So she's a very, very experienced, very, very well-respected and very warm person. And so she talked with us, and she shared this slide. So this is from her, which really shows that in California, the older adult population is growing fast, and that by 2030, people 60 and over will comprise 25% of the population. And if you look at the graphics in 2010, distribution of the California population by age group, by year, you'll see that by 2030, there will be more people 60 and older than there will be 18 and younger. So we're having this seismic shift in our society where we're going to have more older people than younger people, people who are minors. And Susan suggested that as a response, the state will need to shift resources from some of the child and youth-based programming into older adult programming to be able to meet the needs of the population. And so in response to this, the state governor called on the state to create a master plan for aging. And Harriet told me that you all have talked about the master plan before, so we don't need to spend a lot of time on it. You'll see that the master plan is really the blueprint. What is the state going to do to prepare for 2030? And then simultaneously, they also worked on a long-term services and supports, that whole arena of what are we going to do when people need healthcare in the home. And then they also looked at Alzheimer's prevention. So the state, with all its resources, has really looked at what does the state need to do. And there are 5 goals. So this may be a repeat: housing, health, inclusion and equity, not isolation, caregiving, and affording aging. Those are the 5 main buckets. And I will say that there is a lot of work going on around the caregiving piece. And I believe the Caregiver Resources Center were successful in getting some more funding to be able to reach rural communities, communities that aren't English speakers, some of our more communities that are underserved. And there's a lot of work, of course, going on around housing. One of the really big bills this year was a bill to provide some rental subsidies to older adults to prevent homelessness. So a lot of work going on. And we villages have our own objective or our own initiative within the master plan: promote and adopt, or it's really adapt, the village model for older adult volunteerism and services, building on the strengths of California's diverse communities. So we're really thrilled about this. This was a joint effort where Village Movement California pulled together the 46 villages in its membership to really promote villages as one of the options, one of the choices, one of the models of care that the state should support as we prepare for this aging of our community. So we're working really hard at Village Movement California to fulfill this initiative. We went to the state for funding. We did not succeed at getting the funding, but we did succeed at getting better known. And we are creating a few programs to bring more people from diverse communities into the village movement and to support the development of new villages. So we're very, very active in that right now. So I wanted to talk to you about the missing middle or the forgotten middle. I'm wondering if any of you have ever heard this term. You can just open your mic and say yes if you have. No. Well, this is interesting. This article that I have up on the screen. So for those of you on the phone, I have a photograph of an article that was in a journal called Health Affairs. And the title of the article in this journal, in this magazine, is "The Forgotten Middle, many middle-income seniors will have insufficient resources for housing and health care." And what this says, it's what we know intuitively, that as housing costs increase, so particularly if you're a renter, you don't own your home and you don't have a mortgage that you've either paid down, or it's if you haven't had to borrow against the house, might be a reasonable amount. If you are a renter in particular, you understand how expensive housing is getting. And then we all know how expensive healthcare is getting, even with Medicare and the supplemental plans. There's still, with prescriptions and other things, the costs are going so high that this article said, look, if our older adults are going to be in a real bind as they age, because they're not going to have the money they need to pay for both. And so that's the alarm bell. Another word we use for this group is people in the eligibility gap. So we know that in California, we have a public aging services network, and the California Department of Aging is in charge of that. The area agencies on aging provide meals, they provide in-home supportive services, they provide information and referral. For the most part, these services are only available to people who qualify for Medi-Cal. So if you are an older adult who makes too much money to get Medi-Cal, then you're excluded from a lot of the services that are available. So more and more people, including people in the state government, the legislators, are really starting to talk about how do we support moderate and middle income older adults. These are the people who have worked for government, they've worked in the nonprofits, they've they've been the teachers, the firefighters. What are we going to do about this group of people? And if you look at this next slide, this comes from that study, and it's just a graphic, it's a bar graph that shows the millions of seniors, and they have these different colors for people who are high income, middle income, and low income. And you'll see in 2030, the middle income group is the largest group. In California, that's 3.4 million people. And so there are 3.4 million people, and there's very little for them. And that's where villages come in. We find that for the most part, we have served, I'm going to stop the share for a minute. We have found for the most part that our members are moderate and middle income folks. We do have some people who are, part of what we call the professional class, but they come into the villages and they don't know what they're going to do about aging and about what they're going to do about the kinds of supports they might need. If they're like most older adults, they don't really know what's in store for them, because in our society, because of ageism, we actually pretend like we don't have older people, or that aging doesn't happen to everyone. And so people are really, really unprepared. I think one of the reasons that I accepted the position that I'm in now is that I wanted to learn more about aging. I wanted to do a better job of helping my parents, 89 and 90, to make choices. And I want to know more about what's in store for myself. So this whole position has been a win-win for me. So before I move on to talk about villages, are there any comments or questions about anything that I've said? It looks like Terry, you have a question or comment.
I wanted to make sure I heard this right. How many villages do you have in California? Was it 46?
There are, I think there are 48.
48.
46 are members of our organization.
Okay. And then where are they mostly located?
I'll show you a map. Oh, let me show you the map. Hold on. Hang on a second.
I'm just wondering if you find each group, I work a lot with the homeless and with affordable housing, and rural and suburban and urban areas all seem to have different needs. And I'm wondering what hurdles you have.
Are you seeing the slide?
No, not yet.
Well, I'll describe it and then I'll share it later. I don't want to spend a lot of time fishing around. We have a preponderance in SoCal. So it would be LA County. There's one in Ventura. There are a few, maybe 2 or 3 in Orange County. There's one that serves San Bernardino, and then San Diego County. And they're mostly coastal.
Okay.
And then in Central California, we have a village in San Luis Obispo. And then if you move up the coast, we have a bunch of them in the Bay Area. And then if you keep going north, there are several rural villages in Sonoma County, Mendocino County, and then way up in Humboldt County.
Okay.
Then we have another village that's starting in Kern County, Kern Valley, which is a rural, remote area north of Bakersfield. So it's pretty much been an urban phenomenon, these 3 rural villages, and we're really looking to see how we might amplify or spread that.
Okay, thanks.
Does anyone else have a comment or a question?
You can unmute yourselves.
Okay. So let's. I'm gonna show the next slide about villages, and just give me a sec. Okay. All right. Okay. So villages, when we talk about a village, and like with Marcia and Carol, Westside Pacific Villages, we're talking about an intentional, caring community that's led by older adults. We're talking about a way to live, not a place to live. And more, these communities are intergenerational, where people are coming together to really support, but the focus is on older adults, and providing them connections, supports, and expertise to help members maintain independence as they age. So when I say members, villages are membership organizations, and the model that we follow is that villages do charge membership fees. Those fees are determined by the village itself. We're very sensitive to price point and to barrier, the fee as a barrier. So we're constantly thinking about how can we get buy-in as evidenced through financial commitment? How can we create our own nest egg to be able to fund operations and then to leverage additional funding from foundations, the government, business? But how can we do this in a way that we're inclusive? So there are villages that have sliding scale fees so that people pay what they can. 23% of members of villages across the state receive some kind of subsidy. So villages work really hard to discount the membership fee. And here's an example. One of the villages up in Northern California, they have a membership sliding fee scale. $10 a month, so that's 120 years, $20 a year, up to $50 a month, which is 600. And they just ask people to pay what they can. So I'm going to talk a little bit about the specific programming that we do. That I'm going to talk a little bit more about what do we mean by connections, supports, and expertise. So villages are like a three-legged stool. So one leg of the stool is what we call pro-social programming, meaning programs that really seek to build community, build social connections, build friendship. We know that older adults, after they retire, or if they've moved to be near family members, or when their friends have moved to be near their kids, or friends have an illness or a death, that the social network can shrink. So villages are there as an antidote for that. So we do all sorts of programming that's educational, that's social, and that's creative. So I was just talking to the program coordinator at San Francisco Village, and she's finding that in the third year of COVID, people really like the socializing and the arts programming. They're less interested in the educational programming. I thought that was really interesting. When I say members lead, the villages really find out what members are interested in, and then they do the programming to meet those needs.
Is there a director who leads? Okay.
Yes, so most of the villages have staff. Probably close to a half have an executive director. We learned that one of the first positions that villages hire for when they're forming is a membership and volunteer coordinator. So I think part of a sustainable village is having staff. There are villages that are all volunteer run, which can be hard. I mean, you know that from League of Women Voters. It's a challenge. So that would be the answer to that. So when we talk about support, so the village model is volunteer-based support. So we have a cadre of trained and vetted volunteers. That's very important. All of our volunteers go through a training, and the village does that themselves. And they're also vetted in terms of I think driving records if people are going to drive, and other things like that, so that older adults can feel really secure that they're not going to be scammed by a volunteer. Terry, did you just raise your hand?
No, I'm good.
Okay. And so the kinds of supports that we provide, I would say, I don't know if you've heard this term, social determinants of health. It's lingo now for just basic building blocks of a healthy life. So for older adults, some of those things are social connection. That's number one. That's number one, being connected. Transportation, and then you can see the rest of this list. Those are some of the things that we do with volunteers. And another way of talking about this is the independent activities of daily living. This is lingo from the aging services field. Activities of daily living are the things like showering, meal preparation, getting dressed, toileting. And that's when people need to hire folks, licensed services. Villages don't do the activities of daily living. We do the independent activities, which is this list that I have up here. In a minute, I'm going to ask Carol and Marcia to talk a little bit about Westside Pacific Villages and what this looks like there. And then the last piece is this resource and referrals. That's the expertise. And one of the things that the villages do, and I think this is a great reason to belong to a village, is that villages know who the good service providers are. Whether it's they've gone through a formal vetting and screening process, or whether it's just they know from their members which home health care agency is a good agency, which roofer is a good roofer, which plumber, so that people don't have to, people can just call the village and say, I need such and such in order to be safe in my house, and the village can make a referral. And I think another thing about the village, warm links. What I mean is that villages are in a position to really help the member or the volunteer connect with that resource. So rather than just saying, here's a list of numbers, call them, the village will be able to help the member or the volunteer make the call or make the introduction themselves. And I don't know about you, but as someone who's new to this aging services field, and have been working hard to help my parents who live in Virginia, that's been really hard. There isn't a village. And I've been really lucky to find a few people who are very well connected. But I've spent a lot of time on the internet and talking to agencies and not getting very far. And I really wish there were a village where they live. So here is a slide from Westside Pacific Villages and one of the programs that they offer. And I thought I would just invite Carol and Marcia to talk a little bit about how this works. Yeah.
Thank you, Charlotte. And so most of the folks on the committee are familiar with WPV, and actually everything that Charlotte just described, WPV does. So we have programs that provide that social connection. Actually, since the pandemic, during the pandemic, introduced virtual programming. And coming out of the pandemic, we are doing both, continuing to do virtual programming, as well as starting to do in-person programs again. And we're starting slow. Some of them are purely social, some of them are health related. And we actually, in terms of staff, do have a part-time person that helps to organize the different programs that we put out to our members. And at WPV, we consider our volunteers part of the organization and members of the organization as well. So while they may not be recipients of the services themselves, they are a vital part of the village. So we do also call them members. So these programs then are also, while they're geared towards the older adult client members, volunteers are welcome to participate and join in and give feedback. And as you can imagine, there's a fair number of volunteers who are older adults themselves. Others are, we have an intergenerational village, people of all ages. We've gotten great Girl Scouts from Manhattan Beach, which was done through a connection through this group. So that we have young folks that are involved, their parents, business owners, young adults, college students. Actually, USC is a feeder for us, Loyola Marymount University, high schools and whatnot. So anyway, programming is an important part of what we do. The services and programs, or the services, everything again that Charlotte had listed there, transportation is a big part. We were fortunate to actually receive funding through the FTA for a grant that actually did pay for the van that was in that photograph. So we have an ADA compliant van that enables us to transport folks. It's got a pull-out ramp so folks can actually use a walker to walk up into the van. We could roll a wheelchair up into that van if needed. During the pandemic, technology was a big part of teaching folks how to use Zoom. Coming out again, we continue to do that. Before the pandemic, we helped seniors learn how to, connect to Netflix and Zoom movies and whatnot. I noticed Charlotte also talked about fall risk reduction. And that's an important element. So when it comes to health and wellness programs, we have often done a lot of the evidence-based programs like Matter of Balance, Walk with Ease, things like that. And so we will coordinate with a variety of different folks in the community who are certified to train things like that. We have volunteers that have actually become certified. So we do take that very seriously. I might add, Loyola Marymount University, one year there was a class, it was a health and human sciences class, and the students were learning about exercises for special populations. And the older adult population was one of those. And it was the students who actually taught a class. It was a 6-week program that we invited people to attend. And so it was a win-win because the students were learning how to do the different exercises, how to teach people to do the different exercises, how to fall properly, how to get up properly. They even went to some of our client members' homes and did a risk assessment in terms of their home. So we're always looking, that's another wonderful element about villages, is that it's very mutual beneficial types of ways that with the community we partner with, locally, that we look for these win-win types of situations. The referral piece that Charlotte mentioned is also, again, villages become a trusted entity. The client members, their family, they come to know us, they come to trust us. We take folks to doctor's appointments, dental appointments, different medical things. We get to know some of the physicians, and sometimes we're asked, can you tell me about a good dentist in the area? Caregiving agencies, plumbers, all the things that Charlotte said. And it's not just the individual themselves that are in the home, wanting to maintain independence at home, but it is their family. So Charlotte's situation is a perfect example of where we would often be talking with the adult children of a client member, and the adult child doesn't live in the area. And so they are looking to get some additional support and guidance. The other thing that I think is really valuable about what villages do, and WPV isn't the only one who does this, but we actually can help someone who, like, we've had situations where someone has fallen at home and the volunteer arrives to take them to the grocery store, and that's how we discover that someone has fallen. We've actually saved lives. We've talked to people on the phone, and we hear about maybe concerned about a cough that we're hearing. We can actually encourage folks to maybe get medical assistance. And then the other thing that happens with us more regularly is, as folks do need more care, as Charlotte said, as if someone does need an in-home caregiver or more support in the home to help with those ADLs, we can help them come to that decision and hopefully choose to start to get a little bit more help, because we don't want to put them or our volunteers at risk to provide support that maybe we're not able to do. We do the vetting process, we do the volunteer training. So with that, this is what Marcia has walked into and is going to start overseeing all this. We do have a volunteer services coordinator as well, because we do provide a lot of services to our clients. So putting all those pieces together is important. So I think I covered most of it.
Yes,
Well,
you
you
have.
wanna-
If I may just add one thing, Carol. I
Yeah,
think what I
please
heard
do.
from our, what I heard from our staff yesterday was what our members love is that high touch. That we, WPV, provide that high touch for them, always being there that they can call on them. And the question we had was, how, as we grow, how do we continue with doing that high touch that they enjoy so much? So that's the only thing I would add, Carol.
Yeah, no, that's great. And it's true.
Yeah.
We're an extension of a family a lot of times, which is great. So thank you.
Oh, well, you're muted, Charlotte.
Our members are aging in community and the village has their back. And there's a lot of love there. And it's a really beautiful thing. I have just a few more slides, almost done. So I wanted to say that partners are very important. And one of the partners we're really excited about, whoops, close your eyes for a minute. I'm going to go down to the slide. I don't want you to, okay. We're very excited about our partnership with Sisters Aging with Grace and Elegance, which is an organization, Black women's organization, statewide, focused on things that are similar to what villages do. And one of our board members, Carlene Davis, who is in LA, created something called Sankofa Stories and presented it last winter, I can't remember, fall. It's really the voices of Black women talking about aging and aging in place and what they need. And we're really hopeful that a pilot program with WPV and Sisters will begin sometime in 2022. And when we look at our master plan for aging goal about promoting and adapting our model, this is a perfect example of there are women who are part of the Sisters program. They're meeting together a couple times a year and really sharing the aging journey. And the question is, what additionally might they need or want that the village can provide through a more structured volunteer program? And I think, Marcia, you're going to be meeting with Carlene. And I'm actually going to be in Stockton on Thursday with Carlene's co-director, Kiara Harris. We're meeting with a program in one of the Black churches in Stockton, Victory and Praise. Really excited about that.
Fantastic.
Yeah, so here's the map. I think you had asked earlier about the map. We would like to eventually have dots in every county of the state. And that's one of the things we're looking to the legislature for, is some funding for that. And then this is our vision statement. Village Movement California envisions a society where all stages of life offer meaningful opportunities for growth, connection, and joy, where people of all backgrounds and economic means can age with dignity, purpose, and self-determination. So that's our vision, and that's what we're trying to make happen through our coalition of villages, of which Carol is a board member. And we came together, Village Movement California, to grow our movement. So bigger villages, more villages, to deepen our impact. And I think our impact has been profound during COVID. We really kept thousands of people connected. And then to ensure sustainability, which is to get the resources that are needed to keep this movement going and to make sure that people who are of the quote unquote missing middle have some supports. So if you're interested in learning more, reach out to me